Genetic testing is something that's always been important in breast cancer that we've been doing kind of behind the scenes. Here at King's Daughters, initially we weren't able to do the testing ourselves, and we've recently acquired some contracts that allow us to perform the test ourselves, saving the patients from an outside referral. Genetic testing usually comes in the setting of a new cancer diagnosis. There are some indications for the people out in the community without a cancer diagnosis to seek out genetic testing, and that would be individuals with a significant family history.
Certainly having a first-degree relative, meaning specifically parents, brothers, sisters, children, that have had a diagnosis of breast cancer, typically at a young age, usually less than the age of 50, but certainly any age could potentially provide some increased family risk for that. When we do genetic testing, it does a large panel of different genes. The ones that we're most focused on in breast cancer are the BRCA genes or the BRCA genes, because those are the most common ones that we see that are associated with breast cancer that has a genetic component to it. So those are included in the wide array that is tested for, and those are specifically the ones that we're most concerned about, but there are other genetic abnormalities that can increase the risk for breast cancer and other cancers as well.
The way that they do the test have changed. We now do this multi-gene panel. So we're testing for 30 to 70 additional genes depending on which test we use. And what's important there is that before 2014, most women only got tested for BRCA1 and 2. So there's a lot of people that say, oh, I had genetic testing and it was negative. But the guidelines have changed and the science has changed. And so we're actually recommending not just new cancers, but women that have been treated in the past for a breast cancer and may have had a negative test may qualify for expanded panel testing. Anyone that's going to want to talk about potential for genetic testing, or anyone that meets criteria that have been set forth, always receives counseling. So there's pre-test counseling as well as post-test counseling. The most two common questions I get from patients before undergoing genetic testing is, how is this going to affect me and my family? And then also, will it affect my ability to get insurance? In 2009, there was a law passed called GINA, and it's about discrimination with genetic information. And what it does is it states that it's illegal to use the genetic information that we may find to prevent you from getting healthcare coverage in the future. So it doesn't affect your healthcare premiums, it doesn't affect your ability to get health insurance coverage. It may have some implications to things like life insurance or disability insurance. And so people need to understand what they're getting into from that realm.
It certainly can have some implications for how aggressive we might want to be with therapy. So it doesn't necessarily tell us if one drug versus another is going to work better, but it certainly may affect which medicines that we choose, knowing their risks going forward.
In patients with a cancer diagnosis, this information may change their treatment. It may change their plan with drugs, like chemotherapy drugs. It may change whether or not they're a candidate for radiation, and it may change their surgical management. I think the most important thing is, number one, get a screening mammogram every year if you're over the age of 40 and a woman. If you think that you have a family history or you feel like your family history makes you higher risk, tell somebody. Bring it up at your next mammogram appointment. The imaging center has tools available to screen women to see if they would meet criteria for different kinds of screening for breast cancer, or if a conversation in our office is warranted. A primary care doctor or gynecologist or the imaging center is all able to do that to see if you meet criteria.